and welcome back to my channel. If you're new here, tell me down in the comments. I'd love to say hello. I'm Colleen. I am the owner-operator of Serene Primary Care in Bellevue, Washington, and I have a direct patient care model, but I also love to share some information, especially about women's health, midlife, and beyond. So today's topic is going to be on bleeding in our menopause transition and what types of things you might expect and what needs to be evaluated more thoroughly with your provider. So let's start with what happens when we're transitioning to menopause. So this is the stage that we're often referred to as perimenopause, premenopausal. This is starting as early as our late 30s into our 40s. What women will typically see is changes in the way that their body bleeds every month. So that might mean you skip months and don't have a cycle for a couple of months. It might mean that you get cycles every 2 weeks. It might mean that your cycles become lighter and you see just spotting, but not a ton of bleeding. The reverse is also true. Some women will have much heavier bleeding and they will find much more clotting, and so it really becomes really impactful on their day-to-day life when they're bleeding so much. So when is it a concern? Generally speaking, as your provider, we should be taking some labs, making sure there's no other underlying cause for why you're having irregular bleeding. So that may be simply doing a pregnancy test. It might be checking in on your thyroid hormone. It might be checking for anemia. It might be looking for diabetes. There's a lot of different reasons why we may look further than at that bleeding rather than just saying, oh, you're in your 40s, that's typical, which it might be, but we need to make sure that that's a true statement before we rush forward. So what are our options for treatment? Sometimes the option is that the woman just wants to know that there's no concern with this irregular bleeding. They don't mind the irregular bleeding. They just want to make sure that there's nothing else going on, in which case our job is reassurance after we've done the appropriate workup. A second reason we might choose to treat is that the cycles are either very heavy or they're very frequent, and it's impacting the woman's ability to really kind of live her life. So we might talk about using an IUD like the Mirena, which typically will stop bleeding for most women. We might choose to do the Nexplanon, which is the little hormone implant that goes right underneath the skin in the arm. We might choose to use the NuvaRing, which goes into the vagina, or we might choose to use a birth control pill. It really depends on the woman, and having that conversation about your preferences and your goals is what drives the decision behind the choice. There may be some risks associated with some of those birth control or those bleeding control options, in which case your provider will really go through those with you. So that's one way that we kind of check into that. We might need to do some imaging, like a pelvic transvaginal ultrasound, because sometimes women will grow uterine fibroids or masses within the uterus that are actually causing that additional bleeding. So these are benign, but they are problematic when it comes to bleeding. So a lot of times women just need to have those addressed, and they also may use one of the previously mentioned ways to control the bleeding. So that's what we can kind of expect as we're transitioning to menopause with our bleeding. So really wide spectrum of what is happening and a very wide tolerance for the irregular bleeding. So the conversation should really be happening with your provider to get you the best care. So what happens after you're menopausal? So menopause is based on an event, not necessarily lab work. So if you are having cycles and you stop having cycles and then it's 12 months and you've not had a cycle, you're considered post-menopause. Some women don't have that marker for various reasons. Maybe they had an ablation done. Maybe they have never really had a lot of bleeding. Maybe they've had an IUD for birth control, so they haven't bled for years. Regardless, and sometimes I should say when that is the case, we're often making our decisions related to age. But if you are a woman who has been bleeding regularly and you stopped bleeding for 12 months and then you bleed again after 12 months, that's a concern. That is something that needs to be evaluated, because one of the first symptoms of uterine cancer is post-menopausal bleeding. So it's been 12 months, haven't had any bleeding, and now I'm having some spotting or I'm having some bleeding. It's not always a concern, but because that can be cancer, it needs to be checked out. So if you have stopped bleeding and then you bleed again after 12 months, get in touch with your care provider right away. They will know what to do. They'll walk you through it. Majority of the time, it's not a concern, but we don't want to miss it if it is a concern. The good news about uterine cancer is that when it is found early, and typically you start bleeding very early in the life of the cancer, it's very treatable. And so it's something that can be taken care of. We just need to know when to look for it. So I hope that answers some questions about bleeding in our midlife and what to watch for and when to ask for help. Anytime you have questions, feel free to drop one in the comments below. I will also include my website where you can reach out to me there as well. Hope everyone has a great day.